Good evening and thank you for joining us. A panel discussion on community safety was held last night at the Brodie Library, featuring 4 influential local leaders. Talks centered around marginalized people, homelessness and violence, and there's recognition of the difficult work ahead. Vasilios Bellos is following the story and joins us live in studio with the details. Vasilios.
Thanks, Ryan. Around 100 people were in attendance to hear from Police Chief Darcy Fleury and other local leaders about their strategies regarding safety in Thunder Bay. As the event neared its end, though, there was some frustration in the audience, who were disappointed Mayor Ken Boshkov didn't attend. Brodie Library was the setting for an important panel discussion in response to high crime rates in Thunder Bay. Fort William First Nation Chief Michelle Solomon, Elevate NWO's Holly Govan, Canadian Mental Health Association CEO Jennifer Hislop, and Police Chief Darcy Fleury were all part of the event, focused on how to make Thunder Bay a safer place. The discussion quickly turned to safety for marginalized groups in the city, who panelists stressed are at higher risk of violence.
We know that there's a serious issue of systemic racism and that Indigenous people are often targeted.
Panelists pointed to lacking safety for other groups, mentioning the recent vandalism targeting the 2S LGBTQ+ community. Hislop believed youth support and activity is a great way to prevent kids from falling into crime, criticizing the recent city decision to close 9 outdoor rinks.
Why would we make a decision that's going to further impact marginalized families and their children and only support, say, those who could really afford high-level hockey?
Mental health, addictions, and homelessness then became the focus. Govan says there's a lack of resources in the city, with Elevate currently serving 60 people living in encampments.
It's a lot of people, and so even if we were to fill up all the beds that are available, there's still not enough beds to go around within our shelter system.
Police Chief Darcy Fleury called on more funding for mental health and homeless support organizations, stressing enforcement doesn't always lead to the best outcomes.
They may need to be triaged and put into a mental health situation or care so that they can get the proper care that they need and move on with their treatments and a better lifestyle.
There was then visible frustration from audience members and some on the panel regarding a noticeable absence of Mayor Ken Boshkov from the event.
I'm saddened that he's not here to hear the dialogue and participate in it, but I'll reserve judgment.
Remind him that he's a mayor for everybody, not just property taxpayers.
After confirming his attendance, a scheduling error forced Mayor Ken Boshkov to miss the safety panel. In a statement, Boshkov says he informed the library a few weeks ago that he couldn't attend, instead taking part in the Airport Management Council of Ontario's annual meeting at the city airport. Vasilios Bellos, TBT News.
Your sentence for possessing child pornography and committing indecent acts. 56-year-old Scott Gertuga pleaded guilty after police found more than 1,000 images and videos of child pornography in 2021, as well as several hundred images of Gertuga exposing himself in public areas, including parks and playgrounds. With credit for time already served, Gertuga will spend another 7 months in custody, followed by 3 years probation. He'll also be a registered sex offender for 20 years and is prohibited from being around areas used by children under 16. For the first time in the history of Grand Council Treaty 3, a Grand Chief has been elected for a 4th term. Ogichida Francis Kavanagh was re-elected yesterday on the 150th anniversary of the signing of Treaty 3. Kavanagh was elected through a traditional selection process in accordance with Anishinaabe protocols. Besides being a record 4th term, it's also a record 3rd consecutive term for Kavanagh. Grand Council Treaty 3 represents 26 First Nations in the western part of this region, along with 2 communities in Manitoba. In a written statement, Kavanagh said he's humbled by the trust and support of the citizens of Treaty 3. Thunder Bay Superior North MPP Lise Vaugeois took the Ford government to task today over the issues of poverty and food insecurity. Vaugeois challenged the Premier's record, citing a recent Food Banks Canada report that showed 43% of Ontarians feel worse off than they did last year. That report also says food banks themselves are feeling the squeeze. That includes the RFDA here in Thunder Bay. Responding for the Premier, Social Services Minister Michael Parsa hit back at the NDP for voting against a number of the government's bills on social issues.
The director of Thunder Bay's Regional Food Distribution Centre notes that over the next 4 years, their costs will increase by 80%. The NDP has a plan to address this crisis by doubling OW and ODSP and implementing real rent control. When will the Premier stop the gravy train for his friends and take the obvious and necessary steps to address food insecurity in this province?
It's this government and this party that's fighting to make life more affordable for Ontarians. But along the way, Mr. Speaker, you've discovered this all day, all week, the week before. They're against housing. They're against long-term care. They're against school. And they're now clearly showing they're against the people of this province for us to be able to lift them out of poverty, to make sure that we provide the support for people who need them. The largest increase in support in social assistance, every single member across voted against it.
Well, still with news out of Queen's Park, Ontario's health minister says the province will shut down any health clinic that charges for services covered by OHIP. This comes as opposition leaders push the government to ban the practice, as some facilities have come under scrutiny for charging membership fees. Siobhan Morris reports.
It looks like any other medical office, but at this location near Toronto's downtown core and at a second a few kilometers north, a medical checkup will cost you. They're selling annual memberships for as much as $1,200 a year.
OHIP-funded services must be covered by OHIP, cannot be charged.
But these clinics appear to be operating in a gap in the rules based on who's tending to patients.
OHIP is for physicians, it's not for nurse practitioners.
The issue bubbled up last week with the opening of a clinic in Ottawa using nurse practitioners. They're charging a $400 annual subscription.
We opened an investigation and started asking questions last Thursday when we heard about this, and we will shut down that practice if it is occurring.
The clinic says there are 10,000 people on its wait list. When 2 million Ontarians don't have a family doctor,
there is, I literally say, desperation out there for families to want to get access to care. And so they're willing to do that. It shouldn't have to be that way.
The NDP leader says the loophole needs to be closed.
As long as it exists, greedy healthcare corporations are going to continue to exploit it to make big bucks off of people's health.
The head of the Registered Nurses Association of Ontario says subscription fees, paying for visits, won't stop.
Unless the government decides to put all nurse practitioners as publicly salaried.
Not just those working in the 24 nurse practitioner-led clinics open before the Ford government took office.
If there are gaps in the services that people are being charged, then we will look at that and we will close those loopholes.
Though not a promise to fund the nurses themselves.
That was CTV's Siobhan Morris reporting. The Ontario Native Women's Association hosted a Sisters in Spirit vigil this afternoon to remember missing and murdered Indigenous women and girls. This year's solemn event at the local Onwa headquarters highlights the need for action across the country. Josh Morano reports.
Launched in 2005, the Sisters in Spirit vigils bring awareness to violence against Indigenous women and girls. The vigils support and honor the stories, experiences, lives, and memory of missing and murdered Indigenous women and girls.
Women, we are powerful.
Among the keynote speakers was ONWA Executive Director Cora McGuire-Surrett. She says the vigil is important because it gives people the space to honor those who are no longer here, as well as to honor the families who are in crisis due to the murder or disappearance of a loved one. She also notes the problems that are still occurring for Indigenous women and girls.
One systemic failure we have here when we're looking at MMIWG is, the lack of coordination or communication across systems. So, you could have a death that'll occur in one jurisdiction, and they could be from another district, whether it be another province, because violence doesn't know jurisdictional bounds. And so systems really do have to unpack how they work together, how they collaborate, how they talk.
Anne McGuire was another keynote speaker in attendance. She, along with her sister Rebecca McGuire Allen, were there to share their sister's story, Jamie McGuire. She says she's at peace with her sister passing, but turns to the government to do more to help families who have been affected.
And today with the colonial systems, they need to be restructured and need to repair the damage that has been done to our families. And I think with Truth and Reconciliation and the 94 calls to action, it'll address major issues such as housing, violence against women.
This is not just an Indigenous issue. It's not just an Indigenous women's issue. This is everyone's issue. And so therefore we all have a role and responsibility in addressing it, as otherwise we're not going to be able to make an impact here.
Of those 94 calls to action, McGuire-Surrett says only 2 of those have actually been completed. Josh Morano, TVT News.
The Canada Games complex is getting close to reopening, but it will be a little later than initially expected. The city-run facility closed on June 4th, and contractors have been busy making significant upgrades inside. The complex was originally scheduled to reopen just after the Thanksgiving weekend, but city officials have announced that date has been pushed back a week to October 18th. Some of the improvements include HVAC system upgrades, a new boiler system, better showers in the men's and women's day use areas, and a universal barrier-free change room. 80% of the $3 million price is being covered by the federal government's Green and Inclusive Community Building Fund. The improvements are expected to cut annual net greenhouse gas emissions by 776 tons. Tickets for this month's Thunder Bay 50-50 draw have been on sale for less than a week, and the jackpot has already surpassed $500,000. Regional Health Sciences Foundation CEO Glenn Craig admits it's hard to believe what he's seeing.
We're absolutely astounded by the support for the October 50-50. We've had some quick starts before, but this, I think, is, aside from Christmas time, is a record-setting jackpot so far.
As of 4 o'clock this afternoon, the jackpot was already at $537,000. Last month, an Ignace man took home over $1.1 million from the 50-50 draw, and it looks like this month's jackpot will easily surpass that amount. Craig says it's great news considering all that the fundraiser does for the hospital, and he has a few thoughts on why the 50-50 continues to grow in popularity.
Well, we brought back some bonus numbers at both the $75 and $20 ticket package levels, as well as half the funds are being dedicated to breast cancer. And I just think people are enjoying playing the game. We've had some fantastic winners. Our winner from last month, what a great story. Plus people know they're supporting healthcare, and they're making healthcare better for all of us.
The draw date for this month's 50-50 is scheduled for October 27th. Hard to believe that just 5 or